Frozen shoulder or adhesive capsulitis. Frozen shoulder, sometimes called adhesive capsulitis, is a condition that limits movement in shoulder joint. Your shoulder has three bones that form a ball and socket joint, including your upper arm, humerus, shoulder blade, scapula, and collarbone, clavicle. Strong connective tissue surrounding your shoulder joint holds everything together. This is called the shoulder capsule. In frozen shoulder, this capsule becomes so thick and tight that it's hard to move. Bands of scar tissues form, and there's less of a liquid called synovial fluid to keep the joint lubricated. These things limit your shoulder motion even more. The condition is called frozen shoulder because as your shoulder gets more painful, you use it less. The less you use it, the thicker your shoulder capsule becomes, and the more difficult it is to use. So your shoulder feels frozen in place. Causes of frozen shoulder: primary or idiopathic. No identifiable cause. Other shoulder pathologies: acute and chronic rotator cuff injury, shoulder impingement syndrome, SC joint injury, double crush syndrome, post-traumatic, following injury or surgery. Stages of frozen shoulder. Freezing stage. In the freezing stage, you slowly have more and more pain. As the pain worsens, your shoulder loses range of motion. Freezing typically lasts anywhere from 6 weeks to 9 months. Frozen stage. Painful symptoms may actually improve during this stage, but the stiffness remains. During the 4 to 6 months of the frozen stage, daily activities may be very difficult. Thawing stage. Shoulder motion slowly improves during the thawing stage. Complete return to normal or close to normal strength and motion typically takes anywhere from 6 months to 2 years. Symptoms: dull or aching pain in the shoulder, which may worsen at night, or with certain activities. Significant stiffness, making it difficult to perform everyday tasks, such as reaching overhead or behind the back. Diagnosis. Diagnosis is usually made through a clinical examinations and a patient's history. Imaging studies, like X-rays or MRI, may be used to rule out other conditions. It's essential to consult an orthopedic specialist or physical medicine and rehabilitation doctor to determine the best course of treatment for frozen shoulder. Treatments. Physical therapy, a key component to help regain range of motion. Physical therapy includes matrix regime therapy, SIS therapy, cold laser therapy. Medications. Non-steroidal, anti-inflammatory drugs can help manage pain and inflammation. Before medication, take doctor's advice. Corticosteroid injections. These may be administered to reduce inflammation and pain. Corticosteroid injections for restricted use only. Nowadays, PRP therapy is used instead of steroids in most of the cases. Surgery. In general cases, surgery is not required. If necessary, it is performed under controlled manipulation under anesthesia. Arthroscopic capsular release is also used to treat frozen shoulder. Generally, for terminally ill patients where other modalities are not effective, corticosteroid injection and surgery is suggested. Rehabilitation for frozen shoulder or adhesive capsulitis involves a structured program to improve pain, restore range of motion, and enhance functional ability. Here is an outline of a typical rehabilitation program. Phase 1. Initial phase or pain relief and gentle mobility. Phase 2. Intermediate phase or restoration of movement. Phase 3. Advanced phase or strengthening and functional activities. Phase 4. Maintenance phase. To get your mobility back, contact our expert now.